Hello there, I'm Dr. Srishti Banerjee, Masters of Physiotherapy in Neurology, working as an assistant professor at LG Institute of Physiotherapy. Our topic for today is hydrotherapy. In today's class, we will be discussing the electrotherapeutic modalities that use water for its therapeutic purposes. The first one is contrast bath. Contrast, as the name suggests, as you can see in this diagram, that there are two types of baths here. Okay, so contrast bath is a method of alternate application of heat and cold by water. We apply a alternate immersion in hot water and cold water. The whenever we provide any external sensory stimuli, there is activation of cutaneous receptors. So whenever we are immersing the part in the hot water, it will activate cutaneous hot receptors, and whenever we are immersing the part in the cold water, it will activate cutaneous cold receptors. See, whenever any stimuli is given, the receptors, for a prolonged period of time, the receptors will undergo a phenomena which is known as neural accommodation. They will get accommodated to that type of stimuli. The plus point of contrast bath here is that there is an alternate immersion of into hot water and cold water, so neural accommodation does not occur, because as soon as the neural accommodation begins, we switch the temperature. Now, the treatment helps to modulate pain by pain gate mechanism. We are providing a strong sensory stimuli that will close the pain gate and therefore modulate the pain. Whenever we are immersing any part in cold water, that will lead to vasoconstriction, and then alternate immersion in the hot water will lead to vasodilation. So this alternate vasoconstriction and vasodilation will help to reduce the edema due to pumping effect. Also, it will increase the circulation in the deeper part of the body reflexively. Methods of application. See, there we select two baths, one for hot water filled with hot water at 40 to 45 degrees, and one with cold water up to 15 degrees. See, before this, the sensation of the patient has to be examined, like by using an alternate application of hot and cold test tubes. Any metal wands such as jewelry or watches, that should be removed. No open wounds are a contraindication for that. So if we are giving the treatment for pain relief, whenever we are giving the treatment for pain relief, we need to start and end the treatment in hot water. Whereas if we are giving the treatment for edema, we have to start and end the treatment with cold water. Okay, by placing the limb in hot water, see, in hot water we place the limb for 3 minutes, followed by immersion in cold water for 1 minute. We do not place the limb for more than 1 minute in cold water, because it will lead to Lewis Hunting reaction and a reflex vasodilation. Okay, this cycle is repeated 3 to 4 times, and the total time duration is 20 to 25 minutes. The indications here is post-traumatic swelling, pain due to swelling, and chronic inflammation. The contraindications is advanced peripheral vascular disease, arterial insufficiency, diabetes mellitus. The next therapeutic modality is the whirlpool bath. As you can see here, this is how the equipment of the whirlpool bath is. See, there is a motor located at the end, at the bottom of this whirlpool bath. Okay, and there is a turbine. This turbine leads to aeration of the water, agitation, that is the movement of the water. See, by directing the direction of this turbine, we can make the patient exercise in an assistive way as well as a resistive way. If we are directing the turbine towards the affected part, it will lead to an assisted movement, and if we are turning the turbine against the affected part, it will lead to a resisted movement. Okay. Then there are two types of tanks, extremity tanks for distal extremity and high boy and low boy tanks for larger parts, immersion up to the waist. As I said, the height and direction of the turbine determines the effect. For pain relief and wound healing, the direction is towards the involved area. Whereas for granulation tissue, hypersensitive skin, and a wound which has a lot of granulation tissue, the turbine is directed away from the treatment area. The temperature is usually 36 to 41 degrees Celsius, but for acutely inflamed wound, we can use a cold whirlpool which has a temperature of 0 to 26 degrees. Technique of application: first of all, we'll be checking the sensation by alternate application of hot and cold test tube. Then we ask the patient to sit at the edge if we are using the extremity tank. Turn on the turbine and ask the patient to exercise the affected part, and if the treatment is directed for edema and joint stiffness. The total time duration, irrespective of the technique of application, ranges from 10 to 30 minutes. Now, uses open wound to mobilize a stiff joint and pain relief. The advantage is that we can give active exercises with the heating effects, as well as for wound dressings. The assistance of the water is effective in producing exercising the weak muscles, allowing the movement with heat. Now, the disadvantages here is that size of the tank, there is a risk of infection if you are treating any open wound, and cost of cleaning. So this was about the whirlpool bath. Now, the another modality is a Hobart tank. As you can see, it is a large butterfly-shaped tank which is 6 feet wide and 4 feet deep, and it can hold approximately 425 gallons of water. As you can see, there are turbines here. Okay. Now, as you can see, the tank is quite large, right? So it is particularly used for the patients with burns. We can immerse the entire patient into the Hobart tank. It has a provision that from the stretcher the patient can be placed into the Hobart tank for the debridement of the larger parts of the body. Now, procedure: the patient after there is a hoist which can lift the patient from the stretcher and place into the Hobart tank. The patient generally remains in the Hobart tank for 20 minutes until the procedure has completed. We need to quickly dry the patient, okay, and wrap the patient immediately to avoid any of the chilling effects. The advantages here is it can treat large areas and multiple body areas, can be used for heat transfer, for cleansing and deburring of open wounds, and as a water exercise. The patient can exercise into the tank. Now, the size of the tank is a disadvantage. The treatment is quite costly. It uses a large amount of space, right? A large amount of warm water, that it is time consuming to fill and empty the tank, and it requires caution with regard to any possible systemic effect to the large exposed parts of the body, because there is an entire immersion of the patient. Thank you.